Hey everyone, this is J-Dog and I'm here with another video. Here's an article from CBS by Megan Cirillo. Modern vaccine trial lacks black, LAX, and indigenous participation. This is another attempt to shame people into getting vaccines because a lot of people are starting to wake up to some of the risks of getting a vaccine. So they're not going to just go get a vaccine or be part of the test trials right away because they don't want to be the next victims of a new era Tuskegee experiment. But yet, here's their way of trying to shame people into getting forced vaccinations, or trying to set up to create mandatory vaccinations, and there are other evil ways. The first U.S. Phase 3 trials of the coronavirus vaccine has failed to attract a significant number of racial minorities, according to experts. The lack of diversity among participation reflects a long-standing obstacle and concerns among health experts about drug trials. And while diversity in clinical trials is always essential, it's even more vital in developing a effective COVID-19 vaccine because the coronavirus has disproportionately affected minority communities. Why do you think that? Maybe it's because of the fact that black people have hard times trying to get health care, or maybe it's because you try to make us the face of the virus because it was originally kicking other people's butts before it was going after black people that much because of the lies of the lamestream media. The lies of the lamestream media decided to make black people the face of the virus. And also because they're trying to scare black people into getting vaccinated because you know the eugenics. You hear about they're trying to use vaccines as part of their eugenics plan, meaning to wipe out a large number of black people. It's important. Now here's what someone says. It's important that all clinical trials, not just vaccine trials, reflects the population that will use the product or therapy in the real world. Bonnie Underling, director of the Healthcare and Pharmaceutical Management, Big Pharma is who they're talking about, program at Columbia Business School. Biotech Moderna which is developing the vaccine, said on Friday that Black or African American, Latinx, that's the Hispanic community, American Indian, Alaska Native individuals, they do not like to be called Indians, by the way, made up just 18% of the Phase 3, more than 13,000 participants, according to a statement from the company. Roughly half of their combined percentage in the overall U.S. population. The percentage is also far lower than the rates at which people of color, go again with that people of color stuff, are contracting COVID-19, even though there's a lot more, the palm colors that's getting the virus. But of course, the lamestream media is not going to talk about that. Let's just face it, they're trying to shame us into taking vaccines that could be a risk to us. They wanted to make us the guinea pigs, but apparently some of us are a lot smarter to not risk being guinea pigs. A U.S. Center for Disease Control and Prevention studies found that in a review of nearly 600,000 COVID virus cases, 22% of the cases were among black individuals who account for 13% of the overall U.S. population. Even though, how are we 13? I know there's a lot more black people. How has black people lived in the United States and has maintained the number of 13%? There's no way. That is too low of a number for us to still even be around, because we were been around since Jim Crow, since slavery, and we've never moved up, even though our population is actually increasing. And the palm colors population is actually the one that's decreasing more, despite of what's been going on. Yeah. Of the overall U.S. And 33% of cases were among Latinx persons, who represent 18% of the U.S. population. Okay, here go again with that black and brown mess. Black and brown communities are disproportionately impacted by the pandemic. Therefore, their participation is vital so that the results reflect their experience, said Eilering. Clinical trials that aren't racially and ethnically diverse leads to less reliable outcomes in real-world settings. I'm not going to read the rest of the article. But that's just showing you that they're trying to do whatever it takes to get their vaccinations. But maybe the reason why there's a lack of people is because a lot of people don't want to end up in a situation like the Tuskegee experiment, where they just killed black people trying to test the syphilis virus. Or what happened to those slave girls who were harmed when it was coming to those tests and trials, when it came to the creation of the gynecology medical practice, because those girls that were victims of that were black slaves. See, and then you remember recently you had the 2 French doctors that wanted to make Africans the guinea pig for the virus, and the Africans called them out. See, they're trying to shame us because some of us are not gonna just go out there and just take risks for the country. We're not just gonna go and just take some some test trial subject for a vaccine, and then months later we start feeling the side effects and it just kill us off. Because that's the thing. That's why you saw that it was a lot more white people doing it, because they wanted to say, see, it's safe for them. Why don't you come over and try it? And I'm like, when this vaccine comes, and it will come, I'm not going to be just rushing to just get it. I'll wait till some people, because even if it was more black people, not every black person is going to react to the vaccine. Some will react positively, others will react negatively. But then they are desperate to want to try to do mandatory vaccine, meaning you have to be forced to take it, or they'll do stuff to you, like arrest you and stuff. That's what the racists really want happen. They want to mandatory vaccinate black people, and we're gonna do whatever it takes to fight against that. But this is one of their tactics to shame us into just going along with these trials that could put us in danger. because they're trying to say that they're trying to get a vaccine done by this year or next year. And many people, the experts keep saying that that's kind of stupid, because they know that it takes years for these medicines and these treatments and these vaccines to be created, because they're so in a hurry, because they're trying to save the economy in this country, and also because they want to do their eugenics plan. But that's all I have to say about this situation. I'll leave a link to the article in the description box and comment section for you to read at your own time. Also, make sure you hit that like button, share the video, subscribe if you haven't subscribed, and hit that notification bell. But that's all I have to say about this situation. This is J-Dog. Thank you for watching, and I hope to catch y'all in another video. Peace, everyone.